Chair recognizes Christie testifying on behalf of Dollar 4 and self for House Bill 3708.
We've helped patients apply for hospital financial assistance programs at almost every hospital in the nation, but before this work, I spent nearly a decade as a nurse. Despite all my internal trainings and all my years working in that nonprofit hospital, not one person told me about charity care. It wasn't until years later, after leaving the hospital, that I learned that financial assistance programs for low-income patients exist. And not only do they exist, but federal law actually requires nonprofit hospitals to have these programs in exchange for their tax-exempt status. Unfortunately, the law as it's written requires hospitals to have these programs. It does not require hospitals to apply patients for them. That means that if a patient doesn't know about charity care, they could be sent to collections, sued, garnished, all for a bill that should have never existed. HB 3708 could stop that. It's simply proposing that before hospitals send a patient a bill, they check to see if the patient qualifies for help.
I have John Hawkins, registered as President and CEO of Texas Hospital Association, against House Bill 3708. Is that correct?
That is correct.
Chairman Frank.
Yeah, just got a quick question for THA. The bill only applies to not-for-profit hospitals. Is that correct?
That's correct.
Okay. So I've seen a number of studies that show there's very limited difference between the charity work that not-for-profit hospitals do in the state versus for-profit hospitals.
It varies, but the investor-owned public hospitals do a considerable amount of charity care in the state.
They do. I mean, because it seems like they both operate kind of the same. So the charity work of a not-for-profit doesn't seem significantly different than a for-profit. I'm wondering, what is it that y'all are doing that for-profit hospitals aren't doing?
Well, I mean, if you're big in Medicare and Medicaid, both of those payers underpay, so there's a shortfall.
But a for-profit hospital operates in the same arena.
Correct.
So there is no difference. I ask, what's the difference? What does a not-for-profit hospital do for its not-for-profit status that a for-profit hospital doesn't do? Because the reports that I've seen show that it pretty much is the same.
Correct. Sorry, Slade.
Okay, so it's correct. So what's the point of having a not-for-profit hospital if they don't operate any different than a for-profit hospital?
I mean, there's a whole variety of reasons. It's mainly the tax status that has an implication on bonds and otherwise. So
that's kind of crazy. I mean, honestly, you just said the not-for-profit that's not paying taxes, that basically pushing their tax burden to every other member of the community, is doing the exact same thing as an investor-owned hospital.